Hi students, welcome to HSC Biology and Module 8, Non-infectious disease and disorders. This is video number 11. We're going to be looking at the incidence of environmental disease. So this one follows on from the previous one we had a look at, but there we were focusing more on nutritional disease. This time we want to try and look at a disease that's caused by a particular factor in the environment. And in this case, we're going to look specifically at the link between smoking and lung cancer. So we want you to be able to explain these key terms that we've talked about previously, to put them into the context of environmental exposure. And of course, the most important thing is that when we provide you with data, that you're able to analyze that data and come up with some logical, sensible conclusions that you can draw on evidence from the data to help you to support. So as you would be aware, smoking is one of these activities that humans do that we've really tightly regulated. And that's partly because there's quite a history associated with medical studies, with epidemiological studies that have drawn some very close links between smoking and incidences of things like lung cancer. This relationship is about 70 years old, and so we have quite a lot of data. We'll actually look at another type of study called a longitudinal study. It's one of the things that we don't have for some of the more recent things that have happened in society, but it's certainly something that we do have for something like cigarette smoking. This was, even in my own lifetime, I know that the attitude towards cigarette smoking has changed quite significantly. When I was much younger, it was seen as a cool and a very Australian thing to do, have the ciggies rolled up in your sleeve, and a lot of people did it, and particularly young people. It was seen to be a really cool thing to do, and we talked about people like the Marlboro Man. Subsequently, descriptive analysis of lung cancer patients, particularly including all of that demographic data, age, gender, smoking habits, diet, occupation, and alcohol consumption, started to find some very significant links between cigarette smoking and the incidence of lung cancer. Probably this all started realistically in about 1947, where Dr. Richard Dole in London was noticing an unusual increase in the number of patients that he was seeing with lung cancers. And it made him start to think about what sort of things those patients had in common with one another. And of course, that's where a lot of these studies begin. Once, of course, we feel like there may be a link between certain activities and the incidence of certain diseases, then we need to start looking at our studies. Now, this is going to involve two different types of studies that I didn't really talk much about on the previous video. The first of these is a cohort study, and a cohort is a group, like a class, for example, or a year group, year 12, year 11, year 10. These are cohorts. And we can have subgroups within that. If you've got sort of separate tutor groups or role classes within your school, then you would have a cohort within the larger cohort. So what we often try and do with these sorts of things is we look to compare two different groups of people who have lots of similarities between them, except for one of the key things that we're looking for. Now, obviously, there are ethical implications here, so we can't actually take two groups of healthy people of a similar age and ask one group to smoke and then see if they get lung cancer. There's an ethical concern with doing things like that, so we don't do that. But of their free choice, if they choose to do so, then what we can do perhaps is we can have a look at how these groups of people change over time. And this is when we come into this idea of a longitudinal study. So this is a study that's taken place over years. Okay, it has to have a long time frame. And that's because some things actually take a long time to appear. So we can't just kind of do a 6-month study and go, yes, we've got all our results and everything's very clear. Now, it may well be that there's certain types of things that may appear that quickly, but there's others that won't. And particularly if you're going to make the sorts of changes in society that have actually happened associated with cigarette smoking, you need to be pretty clear that the evidence that you've gathered is compelling and is obvious to all of the stakeholders involved in this kind of process. So in 1951, there was a very important study involving 40,000 doctors over a 10-year period who were looking at groups of patients, smokers and non-smokers, and as much as possible trying to make comparisons between the two groups so there was some level of homogeneity. So it wasn't the age of the groups, it wasn't the gender of the groups, it wasn't the occupation of the groups, it was actually the fact that they were either smokers or non-smokers. This was believed to be the key factor. Remember too, we're also looking for this difference between correlation and causation. And obviously the latter is the really important one. If we can show that there's a really key causative influence of cigarette smoking on something like the incidence of lung cancer, then we can actually say not doing this is going to make a difference, not we see some sort of relationship between these two. And obviously be aware, because we're at this point in societal history around cigarette smoking, that yes, in fact, smokers did have a higher incidence of lung cancer than the non-smoking group, and not by a little, by a long way. In addition to that, there was also a correlation, a relationship between the number of cigarettes smoked daily and the incidence of lung cancer. So it didn't just seem to be about whether or not you were a smoker. It was also about how much smoking you did, what sort of consumption of cigarettes that you had, and how that might contribute to affecting your likelihood of developing lung cancer. So we went from the descriptive studies to our analytical studies to see if we could get some causative data, to then our intervention studies. And the intervention studies came through because we specifically said this is a problem. We didn't, but the governments got together and they basically said, look, we have to do something about this, because the problem is not just the people who smoke directly, but the cigarette smoke that is then being exhaled into the atmosphere is also affecting others. And that was that whole area of passive smoking, which is basically taking in somebody else's exhaled cigarette smoke. And that used to happen. In fact, there were some ridiculous things that happened when this first came through, such as restaurants which had a smoking and a non-smoking section. I'm not quite sure how they trained cigarette smoke to just kind of waft along the line and not cross over. But that happened initially, and it was kind of like a phase in as these things happened. But it wasn't just some limitations that were placed on where people could smoke, and I guess now it's easy to say where you can rather than where you can't, because where you can't is pretty much everywhere. But there were also some specific campaigns. So we've talked about public health campaigns and what, if any, impact they have on the behaviour of people. Usually these are designed to change people's behaviour, to get them to do something they're not doing, such as becoming vaccinated, or to stop doing something they are doing, such as exposing themselves to the sun in the summer without adequate protection, or smoking cigarettes. In addition to that, packaging changed. So packaging was very cool, as I said. You know, the packets used to be rolled up in the shirt sleeves. They were very cool looking packets. They changed to packets with images of people who'd suffered different types of cancers, mouth cancers, lung cancers, some quite horrific images that were put on some of the packaging of cigarettes. And then they changed to just dull, common packaging, so that you virtually were struggling to tell one brand from another. Legislation regarding advertising was also had a huge impact. A lot of the cigarette brands were so financially successful, they were involved in sponsorship of some of the biggest and most popular sport sporting organisations, sporting competitions, and that was withdrawn as well. Legislation was brought in to stop them advertising, even to have the names written on the side of the car or on billboards around the grounds and those sorts of things. So that came out as well. And anyone who's ever purchased cigarettes knows that the sales tax, and probably even if you don't, you would know that the sales tax is massive on cigarettes. It's a specific form of deterrent. It's designed to try and stop people from doing this, or at least make it more difficult for you to smoke. So there's a whole lot of things. And in addition to that, there's some positive campaigns as well, ways of looking at things like gums and patches and things to try and help you deal with this issue. So what was the result of all of this? Well, if we go back and have a look at some of the graphs that were produced in the UK, and remember this actually started in London, so it probably makes sense to do a little bit of tracking from London results or from results in the UK. And so this is a sort of graph that you might be presented with and then asked to analyse, asked to sort of see if you can explain what's going on, identify trends. We can see some downtrends. I can also see an uptrend here. And also to see if you can think about some of the reasons why. So let's have a look at this. So first of all, we start back in the 1950s. So this is the area we're looking at first of all. When we look at the 1950s, what we're saying is that the smoking rates were in the vicinity of 65% of males, and about 40% of females were smokers. So a high proportion of the adult population that smoked cigarettes in the 1950s. So it was a lot of data. In fact, it was probably more difficult in some ways to get the cohort that were non-smokers than to get a cohort that was smokers. So we found that over time, these figures wobble around a little bit, and there's a sort of an area, I guess, that we might look at next around the 1970s. Smoking rates in women were still rising until the 1970s and then fell more slowly away than smoking in men. So you can see the two graphs are a reasonable distance apart between 1950 and 1970, and as we get closer to 2010, where they almost merge, they're almost together, and both of which are probably more around the 20% mark. So only 1 in 4 people, as opposed to potentially 3 in 5 males, adult males, who were smokers when this whole process began. But of course, it's not interesting just to check what's going on with the rates of smoking. What we could say is that obviously some of the campaigns that were happening through this time have actually had an impact on driving the number of smokers down. But you can see that the point of this was to see if there is a relationship between smoking and lung cancer rates. And of course, there's a lag time here too. If I've smoked all my life up till now and I stop, there may still be some impacts of the smoking that I've had before. Now, that's just for me as an individual, but if you think about society as a group, there may have been a group, particularly of younger people, who may have come through as smokers, and then because of these sorts of campaigns or because of their own personal choices or all sorts of other reasons, they didn't, and so therefore the numbers of smokers dropped, and so the number of people then later in life who are maybe developing lung cancers has also fallen away. So we do get a little bit of a lag between the behaviour and the consequence of the behaviour at different times. But you can see definite drop in the number of males who are developing lung cancer, quite significant, cutting the numbers down by about half, which is quite significant. One thing which you would want to have a think about is the lung cancer rates in females rising, and in fact still rising at the time of this particular graph in 2010. So we'd want to have a look at some of the impacts or some of the activities that actually occurred during these different types of times to see when ads were banned, when taxes were increased, when billboards were changed, when smoking bans were occurring in all sorts of different places, to see if and what different impacts each of these intervention strategies had. And that's what an intervention strategy is about. It's about making some sort of a change or taking some sort of an action and then trying to measure the actual impact of that change. Lung cancer is just one example of a disease that's linked to an environmental agent, so something that we may or may not be exposed to, and the exposure having an impact on the incidence of that particular disease. This is the sort of stuff that we want you to do, so we'll give you some examples in class to have a look at of different types of data and what you think you can extract from that data in terms of both trends and potential reasons behind each of those trends. Thanks for watching.